Welcome to the pharmacology class, and today's topic is pituitary and thyroid. And now we are starting to learn the neuroendocrine system that connects the central nervous system with the endocrine system. And the hypothalamus and pituitary are the most important parts of this system, because the uh, hypothalamus synthesizes the uh, releasing hormones, and these releasing hormones influence the pituitary that will produce the tropic hormones. So this way, every hormone is controlled by the central nervous system, and the hypothalamus, that is part of the central nervous system, and also uh, controlled by the endocrine system. So the endocrine system is somewhat much slower than the central nervous system, because the activation of the hormone production usually takes several days and can be up to several weeks. And but the effect of these hormones is much larger and um, harder to overcome. So that is why hormones play a vital role in the disease development. And many drugs are used as a replacement for the hormones, or um, or the block the action of the hormones that can be used for the treatment of the diseases. So uh, the first so for every hormone there are not only the hormone itself, but there are many factors that influence the release of the hormone. And first is the uh, releasing hormone. Releasing hormone is synthesized in the hypothalamus and will increase the synthesis of the tropic hormone in the pituitary. Then pituitary will, uh, by releasing the tropic hormone, the pituitary will increase the synthesis of the actual hormone that will take place in the different organ depending on the hormone. For example, for the uh, adrenocorticotropic hormone, the corticotropin releasing hormone is synthesized and in the hypothalamus, and it will go so the corticotropin releasing hormone will be synthesized in hypothalamus and will increase the synthesis of the tropic hormone that is called adrenocorticotropic hormone, that is synthesized from the pro-opiomelanocortin, that is a precursor for the adrenocorticotropic hormone. So this happens in the anterior lobe of the pituitary. So posterior lobe will synthesize another hormones. We will talk about them later. The adrenocorticotropic hormone is a tropic hormone. It's not the real hormone. So it will be released to the blood, and then will go to the adrenal gland, and in the adrenal gland it will increase the production of the progesterone from the cholesterol, and that is the precursor for the cortisol. So then cortisol produced in the adrenal gland and is released to the blood, and this is a true hormone. So, and this hormone will make the actions of the hormone like anti-inflammatory, uh, increases gluconeogenesis, that increases the uh, glucose level in the blood, and also increases protein breakdown. So cortisol release is increased during the early morning. So actually, I think now you have a high level of cortisol, especially those who just wake up, and that stimulates. And also cortisol is released uh, when in emergency situations, like when the people are in stress, so that promotes the uh, defensive factors, like increases the cold tolerance, increases anti-inflammatory actions. For example, during the trauma, the anti-inflammatory action is vital to reduce the edema uh, at the first hours after the trauma, so you have time to get to the hospital, and then they will give you a shot of hydrocortisol, that is the analog of the chemical analog of the uh, natural hormone cortisol, or any other uh, uh, chemical synthetical analog, like of the uh, like there are many actually analogs. Like here we can find, I think, uh, so there is not much actually here, but still we can use the prednisolone and methylprednisolone as a drug. So that are actually another group of drug is not the hormone themselves. So despite the adrenocorticotropic hormone that will lead to the increase of the synthesis of the glucocorticoids, mineralocorticoids, and androgens that will help in the stress situation. There is a growth hormone, or somatotropin. The growth hormone uh, is released by the anterior pituitary uh, in the uh, and its release is increased by the growth hormone releasing hormone. So releasing hormones are produced in the hypothalamus, and uh, the growth hormone releasing hormone uh, uh, will increase the release of the growth hormone, while the somatostatin will decrease the release of the growth hormone, and mostly growth hormone is released uh, during the sleep. That is opposite to the adrenocorticotropic hormone. So growth hormone mostly high levels are at night, and with increasing age, the growth hormone release decreases. That is accompanied by the decrease in the lean muscle mass, and somatotropin influences the many biochemical reactions, like cell proliferation and bone growth. That is why the drugs of the somatostatin are used in patients with diseases of the bone and also with the atrophy of the muscle. And the the mechanism of action of the growth hormone is based on the synthesis of the insulin-like growth factors 1 and 2 and the uh, the therapeutic indications include the growth hormone deficiency in children and also uh, for some AIDS patients. So then somatostatin or the growth hormone inhibiting hormone will reduce the uh, growth hormone release and it also inhibits the release of the insulin, glucagon, and gastrin. Uh, the gonadotropin releasing hormones so influence the release of the uh, follicular stimulating hormone uh, in women and luteinizing hormone and the so the follicular stimulating hormone and luteinizing hormone, like all tropic hormones, are released from the pituitary, and these hormones increase the release of the estrogens and progesterone that are the gonadal hormones, and these are used for the pregnancy, so for the preparing for the development of uh, uh, the reproductive system. Uh, and so it increases the release of estrogens and in females and testosterone in males. So estrogens actually prepare the ovary for the pregnancy, and testosterone uh, stimulates the spermatogenesis. So and these hormones can be used for the treatment of infertility, either in men or the women, and the replacement hormone is human chorionic gonadotropin that is obtained from the urine of the pregnant woman, and uh, they are injected intramuscularly or subcutaneously, and these hormones will uh, injected over several days. They uh, lead to the growth of ovarian follicle and subsequent injection of the human uh, chorionic gonadotropin will lead to the ovulation. So ovulation uh, is one of the reasons. The absence of the ovulation is a common reason for infertility in women. So the adverse effects include the multiple births and uh, also ovarian hypertrophy and enlargement. And also another hormone that is important for the birth is prolactin. Prolactin is stimulating the mammalian glands to produce the breast milk after the pregnancy. So the prolactin is regulated by the oxytocin also, and uh, that is why the high levels of the oxytocin will promote the synthesis of the prolactin and release of the prolactin that will increase the uh, that will stimulate the uh, lactation after the delivery. So the prolactin can be used as intranasally to promote the lactation in case of the lack of the milk for the breastfeeding. Then the hormones of the posterior pituitary include the vasopressin and oxytocin, and those are not regulated by releasing hormones uh, because they are synthesized in hypothalamus and transported to the posterior pituitary, and and they are released to specific signals, and they can be administered intravenously, like for example oxytocin is used for the and for the delivery, and also to stimulate the lactation, because oxytocin will increase the levels of prolactin as well. So two indications, and then vasopressin uh, is uh, is used to uh, increase the reabsorption of the water in the kidney. So oxytocin usually injected to induce the labor, and that is the main indication. And the because of the chemical uh, structure of the oxytocin and vasopressin are similar, oxytocin will increase the uh, will increase uh, the blood pressure, so and make some vasopressor effect, uh, so will lead to the water retention, and so this is one of the adverse effects. But the effect of the vasopressor effect is less than from the vasopressin, unless the vasopressin is present in the solution, because sometimes the oxytocin is produced from the animal sources, so like the from the pituitary of the uh, animals. Uh, So, and the last one is the thyroid hormones, and thyroid hormones are synthesized uh, in thyroid glands, and the iodine is required for the synthesis. So the first step is the synthesis of the thyroglobulin, that is the globulin with the tyrosine residues. Second step is the iodination. So iodination will require the iodine that is obtained from the food, and the drugs that inhibit the iodination will decrease the levels of the tyrosine and triiodine or and tyrosine. So the iodination it will be on meta uh, position. So then after the iodination there will be a condensation using the oxygen bridge, and this step is inhibited by propylthiouracil at metamazole. So and then the synthesized hormone will be released uh, to the blood, and two hormones can be synthesized, that is 3-iodotyrosine and tyrosine. Both have same activity, but tyrosine is more active than 3-iodotyrosine. So the and the uh, these hormones are active after oral administration, unlike the most hormones. And there are two diseases: hypothyroidism, that is usually an autoimmune destruction of the thyroid gland, and the the disease is treated by the levothyroxine, that is the analog of the hormone. Um, and also liothyronine can be used for the combination of these two. Uh, and the second disease is hyperthyroidism or thyrotoxicosis, or the Graves' disease. And the treatment is removal of the thyroid gland using the radioactive iodine, and also the inhibition of thyroid hormone synthesis with the propylthiouracil or metamazole can be used, that will decrease the synthesis by acting on the iodination and condensation steps. Iodine itself can also decrease the synthesis, but this is not a continuous effect, so it will decrease only first several weeks. Uh, so this effect is called the decrease in the thyroid production of with the iodine is called Wolff-Chaikoff effect, and it only lasts several days, so that is why iodine is not used for the treatment, for the long treatment, only for the uh, thyroid storm. So the beta blockers are also used for the thyroid storm to prevent uh, the excess release of the adrenaline. So to prevent the action of the excess release of the adrenaline, because the sympathetic stimulation will be seen with the increased level of the thyroid hormones. So I think that is all for the Sunday. So sorry, Saturday, and hope you enjoy the uh, spring sun. So and the weather is much better now. So try uh, uh, to be more at the fresh air outside. Uh, so for the warm days, and try to enjoy and relax for while you prepare for the classes. So see you next week, and have a good day.
See you.
Good night.